Εντάξει, να σας καλωσορίσω. Καταρχήν, καλό μήνα, καλή ακαδημαϊκή χρονιά σε όλους τους φοιτητές και τους συναδέλφους. Στα πλαίσια τώρα αυτής της, κάνουμε μια προσπάθεια εδώ και κάποια χρόνια να φέρουμε κάποιους ειδικούς να μιλάνε στους φοιτητές, για κάποια συγκεκριμένα θέματα και επομένως με τον τρόπο αυτό βλέπουν και πώς γίνονται και οι διδασκαλίες σε άλλα μέρη του κόσμου, της Ευρώπης προς το παρόν, έτσι όπως είχαμε φέρει παλιά τον καθηγητή τον Φρέι, μετά είχαμε φέρει τον καθηγητή τον Νόη και τώρα έχουμε τη χαρά να έχουμε σήμερα μαζί μας τον καθηγητή Λάζλο Φόντορ από την Ουγγαρία. Είναι καθηγητής μικροβιολογίας και λιμωδών νοσημάτων και έχει και την ιδιότητα του πρώην Προέδρου της ΕΑΔ. Έτσι είναι αυτός ο οργανισμός, αν θέλετε, ο οποίος πιστοποιεί τις κτηνιατρικές σχολές. Είχαμε λοιπόν, εντάξει, αυτό το μάθημα βέβαια γίνεται κυρίως για τους φοιτητές, αλλά δεν βλέπω και πάρα πολύ έτσι την πρώτη ημέρα της χρονιάς. Εν πάση περιπτώσει, εμείς θα συνεχίσουμε, γιατί είναι κάτι το οποίο είναι καλό νομίζω να συνεχίζεται. Τώρα, πριν δώσω το λόγο στον κύριο Φόντορ, τον καθηγητή Φόντορ, θα ήθελα τον πρόεδρο να πει δύο λόγια.
Okay. Thank you, Spiros. Dear friends, dear colleagues, I would like, on behalf of the colleagues of Veterinary Faculty of Thessaloniki, I would like to welcome Professor Laszlo Fodor. And it's a great pleasure for us to be here with us and to give this lecture today to our students. I hope that all these activities, like this one, enhance all the integrated European studies and lectures. And I hope that the department of Professor Kritas and his colleagues, they will continue on this way of thinking to call and to have with us people like you. As Professor Kritas told, Professor Fodor was a past president of EAV, and I think that he has a great experience on European way of teaching. And the way of his lecture today is what Spiros said, to know, to see everybody of us, how to give the lectures and how to share the knowledge between international professors in international audience. So, Professor, the floor is yours. So you can start.
Yeah, I have a microphone, so I don't need yours. Yeah, we can prevent the interference. Thank you very much for the invitation. I have to reduce my voice because normally I speak without microphone and I accustomed to speak a little bit loudly. I received from Spiros half an hour to give my presentation. And I put my watch here, which can warn me on the moving time. However, without glasses, I don't see it. But to show the positive approach. Spiros asked me to give a lecture on Actinobacillus neuropneumoniae and the pneumonia caused by this agent. And it is a great pleasure, but I was informed, perhaps a little bit misguided, because I was prepared for young students. Everybody is young in this room, but as I see, everybody has a certain experience, so I have a bad conscience whether I will present only well-known facts only. But I try to do my best. But before going into the details, I would like to introduce shortly my school, which was founded more than 200 years ago in 1787. And what is quite an important thing, that since that time, however, there were revolutions, wars, and uprisings, and several historical events, the school was continuously working and is continuously working. We have just opened the 232nd academic year, just a few years before. We are an independent school, so a University of Veterinary Medicine. We teach we have two courses, two undergraduate courses, one in veterinary medicine, that's the traditional, and we have a special course for biologists, mainly for a research-oriented biologist. We teach in 3 languages. We have a complete course in Hungarian for the local students. We have a complete course in English for the international students. And we have the basic subjects in German as well, so they are in the first 2 years. And what is important, I am from the Department of Microbiology and Infectious Diseases, so for us infectious diseases are always very important. The school is located a little bit similarly like here, so we are actually in the middle of the city. It used to be the edge of the city, but the city was growing. But our campus was built to a vet school. You can see this big bull, which was a live bull, a real bull, a breeding bull, a champion. He is greeting everybody, but as you see, there are special decorations on the walls. The buildings are 140 years old. Special decorations, but if you see even the fence, the statues of the fence have special faces with these animal faces, animal heads. The school is in all the buildings. As I mentioned to you, most of the buildings are 140 years old, but inside they are quite modern with a lot of students, so it was rebuilt several times. In addition to the normal classes, there are some extra activities of the students. We have a special occasion for students when they can present their research activity, but there are several students who play music, and even the barbecue is very popular. We have a Department of Microbiology and Infectious Diseases with exactly the same name like here. We include actually 3 parts. We have a bacteriology lab, a virology lab, and an immunology lab. And it is not a big institute. We have 10 academic staff members, some laboratory assistants and administrative staff, and a few PhD students, and we located in this old building out of the campus. We had some important predecessors, and that's why it is good that you are not beginning the microbiology at the moment. Some people who are quite well known, like Augeski, who described the Augeski disease, Marek, who describes the Marek disease virus, but I think personally I like Price Hugo because sometimes I was working with Corynebacteria, and he described Corynebacterium pseudotuberculosis, and some of them can be seen as statues in the garden of the university. Regarding teaching, we have compulsory subjects and optional subjects. Out of the compulsory subjects, there are the 3 components of the microbiology, bacteriology, virology, immunology, and we have an infectious disease, a subject which is called epidemiology infectious diseases. And in addition, in the 11th semester, as part of the students' rotation, we have a laboratory diagnostic practical. It's organized by us, but it is done mainly at the Central Veterinary Institute. And regarding the infectious diseases, we have an own subject. It has 135 lectures and 35 diagnostic practicals. And it is a major subject. For me, that's the most important subject, of course, because it is some kind of an integrative subject. We try to integrate the several things, mainly the characteristics of the different agents, and we try to connect it with the pathogenesis, because to my mind, these are the two main things, because if the students can learn it, in that case, it is much easier to learn the epidemiology of a disease, the clinical science, the post-mortem lesions, and so on. The clinical science are taught at the clinics, and the post-mortem lesions are taught by the pathology, but we have quite a good agreement, so we try to reduce the overlapping. However, sometimes a slight overlapping is not bad. It is something like reminding the students. So when we discuss about a disease, we discuss always the occurrence of the disease, the agent, the main characteristics of the agent, the pathogenesis, the epidemiology, the clinical science, post-mortem lesions, diagnosis, prevention, control, eradication, public health aspects if the disease is a zoonotic disease. And sometimes we like to refer to the public health aspects, food hygiene aspects, the state vet aspects, because I think that it is easier for the students to connect their knowledge. So when we speak about, that was for the students, this slide, so I always recommend to learn the agents, actually the characteristics of the agents, and the pathogenesis together. In that case, the rest will be easier. And now I would like to move to the Lactobacillus pneumoniae of swine. However, if I would have known, if I would have known that the audience will consist of much more practiced people who have experience, I would have left our research results much more, which were erased. Just something about the bacterium. You had a pointer. Could you give me this pointer? How is it working? Yeah. Oh, yeah, perfect. So, Lactobacillus pneumoniae has two biotypes. It is important from the point of view of the pathogenesis, and I will return, because from the bacteriological point of view, they are different because the biotype 1 strains need NAD, but the biotype 2 strains do not need NAD. It's only a fact, but it has consequences because the disease caused by the biotype 1 strains are much more severe, and even the losses are higher. It's a nice gram, what is it? Nice gram-negative bacterium, nothing special, but because of the NAD demand, you can see this satellitism. It's a Staphylococcus aureus, and you see how the bacteria grow only in a small layer where the NAD is present, which is produced by the Staphylococcus aureus. It has 18 serotypes. I hope that the 19th will be described soon. So there are 18 serotypes, and it is interesting to see that the distribution of the serotypes is quite different. We don't know why. In certain countries, certain serotypes dominate, and in other countries other serotypes dominate, and actually we don't know the reasons. We tried to find, but we couldn't. There are virulence variants. That's why we have sometimes severe disease, sometimes milder disease. And these virulence variants can be explained with the differences in the virulence factors. It has different kind of virulence factors. The most important are the toxins. It can produce 4 toxins. Actually, 3 of them are produced by other actinobacilli. Actinobacillus equoli can produce Actinobacillus rossi, Mayri. So these rare species can produce such kind of toxins. But there are 4. But the 4th is produced only by Actinobacillus pneumoniae, and that will be an important point because that can be, or the antibodies produced against this toxin by the host can be detected, and that's a very handy way how we can see whether a herd is infected or not. But there are some other virulence factors. The capsule, it's a polysaccharide capsule, not a very strong capsule. There is a very good, we have a very good collaboration with a British team, and this lady made this photo, and it can be seen that there is a very nice polysaccharide layer on the surface that gives antigenic differences as well, and it will help the bacterium in the survival. On the surface there are some outer membrane proteins. Out of the outer membrane proteins, especially the iron binding proteins are quite important because there is a fight in the host to get enough iron. It needs iron. And there is some Fimbria, not so many, and LPS. And LPS will be an important factor in causing the postmortem lesions. And proteases, some proteases are produced as well. And these proteases are responsible for the postmortem lesions as well. So there's a wide range of virulence factors. Why is it interesting? Because these virulence factors help the bacterium in colonization the host, especially the capsule, the outer membrane protein, the LPS, the Fimbria obviously are responsible for the attachment of the bacterium. There are virulence factors. We can help the bacterium in evasion the immune system. That's why the immune system is a little bit late. For example, these proteases are again some outer membrane proteins and the LPS, and several of these virulence factors, like the toxins, like the extracellular enzymes, are responsible for the local damage of the tissues, and they result the postmortem lesions. Regarding the epidemiology, the agent has a very narrow host range. It's a classical stenoxenic bacterium. Only pigs are susceptible, pigs and wild boars actually. Pigs are susceptible to the infection. Normally, I would say that all age groups are susceptible, but practically not. Because of the maternal immunity, in young piglets you cannot see the disease. Sometimes you can see if a new serotype is imported, but normally in an endemic flock you cannot see it because the maternal protection can cover up to 8 weeks or 10 weeks. There are discussions whether it can be called as a facultative pathogenic bacterium or an obligate pathogenic. It is somewhere on the borderline, I would say. But anyway, even if it's even if we regard it as an obligate pathogenic bacterium, it has to be seen that predisposing factors actually make the clinical signs more severe, like overcrowding, like management problems, nutritional deficiencies, mycotoxins, and so on, poor ventilation, high ammonia concentration or dust concentration, like any kind of respiratory disease in the pig industry. But there are some become infective agents. And in the recent years, we have more and more experience that even the less virulent strains can produce quite good losses in herds where you have circovirus and PRRS virus at the same time. Because of the PRRS virus and the circovirus can suppress the humoral immunity of the host, and that helps actually the bacterium, because normally the biotype A strains can cause a high morbidity and a high mortality, while the biotype 2 strains can low morbidity and low mortality. But you have to take it very flexible, and you have to see the background as well, because in the case of these immunosuppressive virus infections, you can do see severe cases caused by biotype 2 strains. Regarding the pathogenesis, it's a classical respiratory disease, so there is an aerogenic infection. Pathos infection can happen, but in that case you have to increase the number of the bacteria very much, at least 2 indices, sometimes 3 indices. So it is normally inhaled. The infected animals will shed the bacterium with the nasal discharge, with the tracheal discharge when they are coughing, and it is inhaled by the susceptible host, and the bacterium will colonize the respiratory tract. It is interesting that it can be carried in the tonsils, but there is a higher binding to the lower air tract, not the higher respiratory tract. So it likes to go down into the lungs. It has these virulence factors like the lipoprotein complex, like the fimbria, like the capsule material, and membrane proteins, and they help the bacterium in the attachment. And as it was mentioned, several virulence factors help the bacterium to avoid the non-specific, first the non-specific protection, so the mucociliary movement will be decreased by the bacteria, and then what is very important, the bacteria produce these toxins, and the primary target of these toxins are the macrophages, the alveolar macrophages, so the local protection of the lungs will be decreased, and that can be made even severe with the LPS. So the clinical sign, what happens? Actually, the main story happens in the lungs. In the lungs, the cytotoxins, these 4 cytotoxins will attack the macrophages. The macrophages will be lysed, and from the macrophages, several intermediate inflammatory mediators will be released. Actually, it will attract more macrophages, so it's a self-increasing process, and more macrophages will be lysed, more mediators will be released, and that will result, on one hand, the local lesions, and on the other hand, it will attack the endothelial cells. That's why a large amount of fibrin or serum will appear. Fibrin will be precipitated. That's why we will see a fibrinous pneumonia and fibrinous pleuritis. But at the same time, because of the toxic radicals, the proteins will cause local damage, and that will result in necrosis. At the same time, these toxins attack the endothelial cells. That's why hemorrhages will be seen, and hemolysis will happen. That's why in the region you will see a hemolytic pneumonia. That's why hemolytic necrotic pneumonia will be seen in this case. Actually, the LPS will cause platelet agglutination, which will make the thrombi formation, microthrombi formation, thrombosis even more severe. Generally, the whole process is confined to the lungs. However, sometimes we have seen that it can be generalized, but it is quite rare that the bacterium will reach other parenchymal organs. Some animals recover, but they remain carriers. About the clinical signs, typical respiratory clinical signs will be seen. What is perhaps typical, that very frequently you can see nasal discharge, and this nasal discharge contains blood. Sometimes hemolyzed blood is, and because of the suffocation of the animal in the agonia, they produce foam as well, and the high fever, of course. Regarding the pathology, the most typical lesions are the acute form, can be seen in the acute form. Hemolytic necrotic pneumonia will be seen. The appearance is quite good, and the students like it because it's easy to recognize the different lobules in a different phase, because the toxin production is different in the different kind of lobules. You see that the septa are a little bit enlarged, and you see the fibrinous pneumonia, pleuritis, sorry. The animals can recover, and when they recover, in that case, you can see a demarcation. In that case, you will, that will be the next story. So in the acute form, different kind of pneumonia can be seen. Sometimes you can see only local foci, sometimes you can hardly localize the lesions because the whole lungs are seen. The lesions are quite deep. You can see they go deeply into the tissue of the lungs. Sometimes larger areas, again a deep lesion will be seen, and the fibrinous pleuritis is quite typical. Histologically, what is very nice, like in the case of the Mannheimia hemolytica infections, you can see that the alveoli, alveolytic cells, the nucleus will be a little bit elongated. It's a result of the toxin again. It's an effect of the toxin, and you can see, of course, the fibrinous pleuritis. Sometimes you can see chronic lesions. In these animals didn't die. These pictures were made on the slaughterhouse, but if you make a cut, exactly the same lesions will be seen, but they are demarcated. Regarding the diagnosis, we always emphasize that the diagnosis of a disease, of an infectious disease, has to be made always by the local veterinarian who sees everything. He knows everything, not the lab. So he can judge the epidemiologic data of the disease. He can see the clinical signs, the post-mortem lesions. And if he is well trained, and if somebody is graduated from our school, he has to be, then, but I am biased. So if he's well trained, or he or she, in that case, he can make a good differential diagnosis and can ask a well-oriented lab examination. Regarding the lab examination, we have basically two options. We can detect the agent, and the agent can be detected quite easily because it can be isolated, but we cannot forget the special cultural demands of the bacterium. It is possible to detect it with immunofluorescence or with PCR, with a co-agglutination test. With PCR, we like to detect the toxins, the toxin or the toxin gene actually, and it helps the diagnosis. Regarding the detection of the antibodies, you can use any types of of classical serologic tests like agglutination or precipitation can be, a complement fixation test can be used. Nowadays mainly ELISAs are used. But the ELISAs can give quite a lot of cross reactions, and what we like is the detection of the antibodies against the APX4, which is the fourth toxin, as I mentioned to you, and this APX4 is carried only by Lactobacillus pneumoniae. So if you detect antibodies in a herd against this APX4, you can be absolutely sure that this flock is infected. And you need further examinations to find out with which serotype. Regarding the differential diagnosis, which has to be made by the veterinarian on the spot, basically we have two main directions which have to be sorted out. We have the generalized diseases because the animals are absolutely depressed, they have a high fever, they do not eat, which can be other reasons in the background. Nowadays, the first what we mention is the African swine fever, which will be in the topic today, or classical swine fever or Algeski disease, so these classical febrile diseases, or with swine influenza. But since the most important clinical signs are connected with the respiratory tract, you have to sort out, or you have to think on other respiratory diseases like mycoplasmosis, which is quite common, but in that case the postmortem lesions are quite different. Pasteurlosis can be, but again the localization is different, because in this case always the diaphragmatic lobe is, you can see the lesions in the diaphragmatic lobe. In the case of pasteurlosis, always in the anterior lobes. You can think on Algeski disease, but the histology is different in that case, or the PRIS, which is nowadays quite an important problem as well. How to treat? The bacterium fortunately belongs to the Pasteurellacea, which are susceptible to a wide range of antibiotics. You can use fluoroquinolones, macrolides, beta-lactam antibiotics. Nowadays I would say that formerly we use tetracyclines quite a lot. Nowadays tetracyclines are perhaps not the first choice, but macrolides can be used, fluoroquinolones can be used better. Since this disease is spreading, we always recommend that first an antibiotic susceptibility test has to be done. We have large pig farms where it is very important to have a targeted antibiotic treatment. But if you use antibiotic, it is advised to use individual treatment in the case of the seriously diseased animals. But since the disease is spreading, it is an aerogenic spreading, metaphylactic treatment of the complete herd is recommended. That can be done per os with the drinking water. But you have to know that even in spite of the most effective antibiotic treatment, carriers remain, and these animals will shed the bacterium. This antibacterial treatment is successful when you use at the same time, when you improve the hygienic conditions and eliminate the predisposing factors. Regarding the prevention, general preventive methods are very important. Just the general hygiene, the good quality of the air, which is always important. But in this case, I would underline the importance of the all-in, all-out principle, because if you leave carrier animals from the previous flock, that's the best way to maintain the infection chain. Regarding vaccination, there are several vaccines on the market. The oldest vaccines were based on the capsule material. So inactivated bacterium vaccines, they are available, they are not very expensive. Actually, they can be used without any problems, as long as you have the same serotype, because there is a serotype-specific protection. The cross-protection, sometimes between some serotypes there is a limited cross-protection, but practically you can forget it. There are toxoid vaccines. They appeared on the market about 15, 20 years ago. They actually not only they kill toxin, but not only the kill toxin, but some surface proteins, so extract of surface proteins are present as well. They are much more effective. Unfortunately, they are quite expensive. There were several trials with live vaccines. The live vaccines actually are very good. One capsule minus vaccine was, I think, came on the market, I think, in the US. But urease deletion and different deletion of different proteins. Most of them were not working and were not safe enough, so they are not so widespread. However, they are very promising because on one hand they give quite a good protection, and on the other hand, since they are marker vaccines, you can use the DIVA principle, so you can differentiate the infected and the vaccinated animals. And nowadays everybody is hoping to see recombinant vaccines. Regarding eradication is not too easy, but it is possible. It is possible to make a selection, so a test on slaughter, and all the seropositive animals are taken and slaughtered, and the seronegative animals are left. But even in this case, when it was successful, there was always some kind of antibiotic treatment. So it was combined, a selection with an antibiotic treatment. And basically a similar thing was some kind of a generation shift. You cannot wean the day-old piglets, of course, but there was early weaning plus an antibiotic treatment and some good experiences. And of course a herd replacement is a good thing to send the animals to a slaughterhouse and to replace the animals after disinfection with a disease infection-free herd. And that was what I wanted to tell you. Thank you very much.
So, thank you very much. Any questions?
Thank you very much.
Professor Filiousis?
Just a moment, please. Congratulations for your presentation. It was very clear. Would you recommend auto vaccines for the control of the disease? I mean, in this case, you can avoid so many differences in serotypes.
The short answer is yes. Even we made such kind of auto vaccines. In that case, I think they were inactivated vaccines, of course. In this case, I think the most important point is the serotyping of the animals. Oh, sorry, of the strains. So you have, is it speaking? Yeah. So you have to check it. So if you use an auto vaccine, even in spite of the use of the auto vaccine, there are a few animals, there will be a few cases. That's the situation with any kind of vaccines, not only auto vaccines. But in that case, from the cases, you have to re-isolate the strain, and you always have to check whether that is what strain is responsible for it. The problem is that very frequently, according to our experience, there are mixed infections when there are more serotypes. So we had several farms where we had two serotypes. The problem is, if you notice only one, you produce the auto vaccine and you help with it the other one. So, but never mind, it will appear within half a year. So you will see it.
Dr. Petridou?
Oh, thank you for your presentation. It was well. In terms of eradication, do you think it is possible to ever have farms Actinobacillus pleuropneumonia free?
I think it depends on the size of the farm. In a small farm and in a low infection, perhaps it is possible. I have no experience.
So we always have to have or fight every day against actinobacillus. And in terms of isolation, do you prefer to isolate and then perform the PCR and serotype, and then maybe proceed to the auto vaccine? Because the other way, it is not enlightened very much. You don't know exactly what you have to fight for.
Normally in a farm, we make serology. With the serology, you can see whether the farm is infected or not.
How is the publication, the population, how is the bacteria is spread to the population, you mean?
If we want to see how severe is the infection in the herd, we make a serology. And if it's infected and we think that it is highly infected, in that case the best way is the isolation. In this case we always isolate. The PCR, we use the PCR, for example, once we wanted to see the infection of the wild boars. And actually the PCR is more sensitive than the isolation. I absolutely acknowledge it. But with the PCR, it was quite a general primer. We couldn't differentiate between the serotypes. It is possible to differentiate with some overlapping. Our collaborators in Britain, this lady made several sets of primers, and she could differentiate with PCR the different serotypes. But with 18 serotypes, it is a little bit complicated, and there is no multiplex PCR, to our knowledge.
Well, so is it better to try to isolate first and then to perform the PCR analysis? But then we don't know what they isolate, if we were likely to have all the strains, the different strains that were circulating in the farm. We can try to have different
It depends on the number of the samples.
So we have, it's crucial to have a certain number of...
Sure.
Yes.
Not as it
Tell it, please, tell to the farmers, please, not to send one sample. Okay, thank you. Thank you very much. Thank you.
How effective would you consider the vaccine? I mean, generally speaking.
We had good experiences. We made some kind of such kind of auto vaccines, and they were not published, but quite a good, like with the other pasture, let's say. So, so you can reduce the losses, definitely.
Okay.
Definitely. And with the commercial vaccines, we haven't worked with the commercial vaccines. That with the commercial vaccines you can do quite good results.
Would you consider this microorganism as a primary or as a secondary?
That's a long-lasting study. I don't want to begin with it.
Okay.
In my mind, it is somewhere in the middle. So even you can see even very severe cases without real predisposing factors. But if there are predisposing factors, the losses are much higher. So there is an effect of the environmental factors.
Okay.
But I think in several cases the bacterium alone can cause disease. So in this aspect it's a primary agent.
And give this very, very severe, I mean, it's a primary factor. It gives this very severe clinical, yes.
We had very severe cases even in very good farms where you couldn't identify real predisposing factors.
Okay. Thank you. Okay. Okay, thank you, Professor Glaser. Okay. So this meeting was supposed to be mainly that Professor Fodor will present to the students this interesting bacterial disease. I can speak in English so he can understand me, okay? It's not my best, but okay, I hope whatever you like, just ask me. I will try to respond in English. 3 weeks ago, I was going to the States, United States, to follow a meeting. At that certain moment, this African swine fever virus that I'm going to present started in 2007 from Georgia. I'm going to present it. And it was in Romania. So the biggest Romanian farm, that was the biggest, the second biggest in Europe, 140,000 pigs were affected and were killed, all these pigs. When I arrived there, Bulgaria has found the first incident. And 2 days afterwards, Belgium had found the 5 cases in wild boars. So in this conference, 2 sessions were changed immediately and were dedicated to African swine fever. And I thought that it would be interesting for the students and also for the vets that we are now in the hotspot. We are just next to Bulgaria. And that would be interesting to discuss this with you, just to present you a little bit this disease and then to discuss it with Professor Fodor. But also there was a plan to have a teleconference with Professor Hans Knowing. The 5th semester students, he had presented to you some lectures, and it was not possible to have connection with Skype. Okay, so we go on and then we see what we can do. So this is a huge disaster for the pork industry. And I'm mentioning about pork. It's not only pig farming, it's pork, because it has to do also with the meat and all the stuff that they produce. They are produced by pork, by the pig. So let's go. So this is a very difficult virus to be faced. So you can see that it's a very resistant one. It's a very resistant, I'm going to say, complex with many genotypes. There is a clinical confusion with other diseases. All these diseases that were presented by Professor Fodor are getting into the clinical and the differential diagnosis, of course, in the beginning, because when this disease is starting, then there is problem. You can understand that this is not just APP, it's not Actinobacillus pleuropneumonia or PRRS. Then you can realize that this is something more than that. But when you realize it, it's too late, because the virus has spread all over. You have many recipients that harbor the virus, which are domestic and wild pigs, and ticks as well, because the virus can survive together with the ticks. Some other carriers that we're going to discuss, there are no effective vaccines. This is a big pain, this virus, because you don't have vaccines. And it is uncontrolled, the spread of this virus is uncontrolled in several developing countries. So basically it's a virus which belongs to ASFI virus. Maybe some of you remember the other genus, which was called iridovirus. It has changed. So this is a very large virus, is very complicated, and is a tough virus. You cannot get rid of it very easily. It's very resistant virus. One big problem is that there are a lot of proteins. We're talking about more than 165 proteins. And proteins they are involved in making functions of the virus. It can be pathogenicity, it has to be the attachment with some cells, it has to be immunogenicity and all this. And we don't know anything about just only for 1/3 of these proteins. So that's a big problem with this virus, and we cannot produce vaccines. And just for the history, this virus was maintained for hundreds or maybe thousands of years together with warthogs. This is a warthog. And this warthog is living in this area. together with this tick, soft tick, who belongs to Argacidae, so it's Ornithodorus. So it can live in this tick up to 5 years. So if you don't kill this tick, then it's very easily to transport the virus in these areas, of course. The transmission of the virus is basically associated with the blood. It's not a virus that can be transmitted easily with aerosol, with the air. But you can see with all this, in all these cases, you can, the virus can be transmitted both to wild boar and to domesticated pigs by materials. For example, contaminated materials by human, and that's a big problem. Hunters in this case, that has their boots, of course, if someone is going to kill a pig, okay, and it has blood in his boots, and he's moving to another place and doesn't clean the boots, then it transmits. It is possible to transmit the virus. Also, this is a very important point with the feed, okay, so, and that's how usually this is transferred to transported to other places. So if a farmer or someone has a sandwich, a nice sandwich with ham coming from an infected boar, and then he throws the rest out, and it is taken by another pig, then the pig is already infected. Boars, which are contact with another infected boar, don't forget that when you kill a boar and the remnants of this boar are going and ingested by other wild boars. So they eat it and then they go to other places. And the same ways of transmission are valid also for the domesticated pig. And the ticks also play a role, but when there is this tick, if there is not, we don't know if there are other insects that transfer this virus. And the big problem is the connection of these two. So we are talking about the backyard pigs. Backyard pigs, when we say, are pigs that, an old lady or an old man has in the backyard of his home, and just feed them just to kill them and eat them at Christmas or at Easter, to special cases. But these pigs have very low biosecurity. No disinfections, nothing. And the boars are whether they are wild boars or they are domesticated boars, domesticated pigs, are quite social animals. And they go and come in touch with other viruses. So these are some pictures, as you can see here, with the boars, some wild boars here. I think you can see this in the outskirts of Thessaloniki, or even in Athens. You can have such cases that you can see a boar and go in inhabited areas. Because they are hungry, so they go to find food there. Or some cases with a hunter that opens, throw it away, and then some other boars are coming and get contaminated. Swill feeding, that's a big problem, and that's how the virus came in Georgia, as I'm going to say, Georgia. Swill feeding means all the trash from the cookings in an aeroplane or in a ship, they are thrown. So small farmers are going, they take it for nothing, and they give it to their pigs. So that's how it started. And these are the backyard pigs. Another case, another thing is this one. So in Romania, you had a lot of pigs that were infected in farms or backyard pigs, and the owners were afraid of declaring them. So they just took the dead pigs and just throw them in Danube, Dunavis, okay, in Danube River. And then these were spread to other farms, taking the water for watering the pigs, for giving it the pigs to drink, and how they are contaminated. The virus is very stable, so you can see it can live in wide ranges of temperature from 4 to 20 degrees Celsius. pH is 4, 13. It is very well preserved in blood secretions and excretions. In the feces, you can see in the environment, a wild boar can defecate, and you can bet that for 7 to 15 at least days the virus will be there in the feces. Repeated freezing and thawing, as well as meat products, particularly in non-sufficiently cooked animals. This is there in such carcasses, in salty, dry, smoked animals, carcasses, the virus lives for many, many months. And also in freezers may stay for years. So it's a very, very harsh, very, very stable virus. It can be destroyed by heating when you have more than 60 degrees in more than 20 minutes, some lipid solvents, some disinfectants. How the story has started from the area that virus was actually present it is known that it has been to Iberic Peninsula for more than 30 years. So the Spanish tried to get rid of this virus. So at a certain moment, the virus has spread here to Belgium because of a salami. Someone took a salami and went to this, and then he threw it. But fortunately, at that time, it was eradicated very fast. Nowadays, it has disappeared from Iberic Peninsula. The only place that it still lives is in Sardinia. And we're talking about genotype 1. You see this green one is genotype 1. Now, the recent cases came very recently to Georgia is genotype 2. There are another 23 genotypes not known. This is starting from here, Mozambique, Madagascar, I don't know exactly. So with a ship that just crossed Suez Channel, has been in Georgia. And then the swill feeding, the remnants of the feed that they use for the people, just thrown to piglets, and that's how it started. And of course, in this place here, it didn't, the symptoms that I will show you afterwards were not very characteristic. They didn't know exactly what sort of disease was that. Actually, it happened in one pig, maybe they didn't pay attention. It was in backyard pigs, so if you have the old lady that has one dead pig, it doesn't pay attention to what is it. Or there is no connection, it was not in an organized farm. So they lost 2-3 months, and then they diagnosed it by laboratory examination. So just having a look what happened in 2006, then 2007, 8, 9, 10, 13, 14, 15, 16, 17. You see? Start going the other way, Asia. And now, at this moment, you have it in China, and there is in Romania as well. And China is a huge player because Chinese produce and consume more than 50% of the pig worldwide. So these areas here, China has about 1/3 of it is plain. The other 2/3 of it is mountainous. So imagine that all of these pigs are in this area here. And in China, you have more than 50% of the pigs are backyard pigs. So you cannot control it. They cannot control it. These are the backyard pigs. And now Americans and Europeans have been to China, and they start building, this is a pig farm here. Every store, this is an 8-store pig farm, one store is 1,000 sows. Okay? So imagine if one pig will be infected in this place here, what will happen? Okay? Another big problem that Americans are really fearing of is this thing, because due to the trade, they import a lot of grains from China. And look the situation, how the Chinese are drying corn and wheat and all the stuff. So it's not very difficult. You know that a boar, a wild boar, an infected animal will go there and defecate, and that's finished. When they collect it, everything goes to the United States. And Scott D, someone in this Lehman conference that I was, have checked these different viruses, how stable are in different fields. So you can see that African swine fever virus was the most resistant and was alive after 30 days post-inoculation. This is a close what happened here in Bulgaria and about the pigs that I told you before. And okay, let's talk about a little bit about this pathogenesis of this virus. It can be ingested, it can be taken, received by the pig by all routes. Usually it's oronasal, but also by bites or by ingesting ornithodoros. It replicates in the tonsil and regional lymph nodes and cause viremia. Then with viremia, spread to other places, the other organs like lymph nodes again, bone marrow, spleen, lung, liver, kidneys. And the target there, the target are the endothelial cells or blood vessels. Actually, it destroys these cells and there is leakage of the blood. So this is hemorrhagic disease. You will see afterwards the pictures. Then you have secondary replication in these sites with prolonged viremia, and you have then, you can see hemorrhagic lesions in all these problems because due to intravascular, disseminated intravascular coagulation and leakage. So that's the end, of course, okay? What can you see? And after the clinical signs, okay, try to burn these animals. Starting with quite normal clinical signs, fever, inappetence, depression, cutaneous hyperemia. You can see hyperemia, hemorrhages as well. The pigs are going one tied to the other because they're feeling cold. So you see again how many pigs are not feeling very well, hemorrhagic diarrhea, hemorrhages here. Spleen is one of the characteristics. It's grown 8 to 10 times more than compared to a normal spleen. These are lymph nodes here, and hemorrhages in the kidneys and the lung. And here you need a rapid and accurate laboratory diagnosis. At the end, you have these cases here. Or can be chronically infected with less severe clinical signs, but you never get rid of the virus. It continues. That was a description of a case in Russia in 2014. You see now hyperemia, the pigs are down, many of them. Here is an empty cage because the other pigs have died. Spleen. And at the end, you see these cases in Russia. Of course, they didn't leave all the animals to die, okay? Because when only 15% of these animals had died. As long as they detected by laboratory, the other pigs were killed, okay? You don't live to evolve. So, huge importance, you have huge economic losses due to high mortality and increased culling, as I just showed you, and you have big problems, and that's most important for the countries for trade and economic measures. So for instance, the huge economic interest that you see faced by many countries. Germany is the biggest exporter of the pigs. So you see 15-16% of the total exported pork worldwide is coming from Germany. USA, Spain, Denmark, Canada, Netherlands, Brazil, Belgium that is infected at this moment, Poland and France. This, if you sum up all of this, is 95% of the exported pork, which is going in various countries, but the majority of this is going to China. So there are a lot of risk factors that can be have to be considered. So wild pigs and domestic pigs, contact between wild boars and backyard and feral pigs, as told before, the lack of biosecurity, human behavior and practices. As I told you, the pigs were the owners were afraid of declaring the dead pigs and just throw them in the river. Or they just, if they see them that it's okay, they just go in the market in these countries and they sell it. But this pig is going in the food chain. And then they take it. And if they don't like it afterwards, they just throw it to other pigs. And that's how it continues. And this may explain in this evolution of the virus in East Europe that I show you, that you had around of the focus, of this specific focus, and then jump somewhere in the north part of Russia. Okay, apparently that was following the train line somewhere, and someone had thrown this. Ticks may be also important. Problem, as I told you, backyard pigs with low biosecurity. Here, for instance, you can see the countries that the biosecurity, they have low biosecurity holdings. You see, this is Romania here, these areas. So that means that these countries have a lot of backyard pigs. And these are the countries that you have the density of wild boars is increased. So if you have one country that has a relatively high number of boars, like Romania, and high number of low biosecurity holdings, then this is a, how can I say it, how can I describe it? This is a mixture, explosive mixture. Of course, we don't know how will come, the virus will, the disease will finish in countries like Belgium, that you have, of course, high biosecurity, but also you have some backyard pigs. And this is just in the center of Europe, because these are the most and the highest pork producing countries. Is it important? We don't know, because we know that this Ornithodorus was here, another type is found in this one, but how it happens, and this virus, this disease occurred here in this place, that there is no any Ornithodorus. Who knows if there are some other blood like mosquitoes or some flies, if they can take the virus and can throw it away. It happens for me many times, and that I notice that I have some flies in my car from one place to the other, or some mosquitoes, and you take them from one place and you go in another one, transport them. A big problem with the carrier pigs. Pigs cannot be, can never get recovered really. They can be recovered from the clinical disease, but remain actually infected from all the life. And also these carrier pigs are important source of virus spread. I would prefer personally a pig showing very, very strong symptoms, because I could say this is an infected pig and I could kill it, instead of having a pig that you cannot understand, that is infected, and spread in the meanwhile the virus all the time, so much time. They say that there are more attenuated strains now in Europe, and that will cause a problem. farmers, I said these things as well. Okay, and the last is vaccines. We don't have successful vaccines for this virus. Too many proteins, we don't know how they work. They have done a lot of work trying to make vector vaccines, trying to make attenuated vaccines, but nothing of these things have worked. So actually, I don't know, we have to, for the moment, these are the main control measures in infected, in disease-free countries, and in endemic countries. So, thank you for your attention, and I hope we will have some discussion on these things. Thank you. Yes. Yeah. You can say to Greek as well. Huh?
Thank you for your presentation. I would like to ask, you show us the map with the spread of the virus. Is it possible to know if these strains of virus is the same that came and started from Georgia, or they are coming again and again in this pathway from other places, and we have to cope with other strains?
Apparently, the strains are all these are of genotype 2. So apparently they belong to the Georgian strain, let's say, to the Mozambique or whatever, Madagascar was that. So, but still, as I told you, maybe I didn't mention this. There is poor cross protection. So even if these pigs are infected or recovered, if a new genotype is going to get in, they're finished. It's like a new virus have infected them. Ελληνικά.
Δυστυχώς δεν ήμουν από την αρχή της ομιλίας σας εδώ, αλλά από ό,τι κατάλαβα, η συγκεκριμένη νόσος είναι γνωστή εδώ και 30 χρόνια.
Όχι 30, όχι, εδώ είναι γύρω στα 12-13 χρόνια, από το 7 είναι, στην Ευρώπη, παλαιότερα,
Γενικότερα, ανά τον κόσμο.
πολλά, 50-60 χρόνια.
Αυτό που θέλω να ρωτήσω, πώς πάει η έρευνα όσον αφορά τα εμβόλια. Καθώς η έρευνα στους εμβολιασμούς, στα εμβόλια των δικτύων, όσο ξέρω, είναι πολύ εξελιγμένη.
About the research in the vaccines, how the research in these vaccines is going. That was a question for me, but you can just interfere.
What I read about the vaccine development, there are several vaccines. You mentioned vector vaccines, and the problem is that the virus is very complex. And it is a tricky virus. Spiros mentioned that there are 160 some proteins on the surface, and some of them can bind the antibodies. The problem is not only the targeted antibodies can bind the antibodies, but other proteins. And that's why, on one hand, the animal, what you mentioned, the animal, even after recovering, is developing antibodies, but they are specifically bound by other proteins, and they cannot have the effect. So the problem is not only a technical problem, how to produce a vaccine, but how would it work? And from my point of view, I am not optimistic.
Another thing that I could add on this is that until now it was considered just problem of Africa, so nobody paid attention on that. I will just tell you, I have told to the students as well what happened with the blue tongue virus. That when the blue tongue virus came into Greece, they didn't permit us to make vaccinations. Okay, and when escaped and went to Netherlands, I think, Netherlands and spread to other, that was another, of course, genotype, you know, everybody started to make vaccine. And in 2 years, 3 years, it was cleared. But this virus is quite more simpler compared to this one. This is a very, very simple, this is a very, very complicated virus. even in the course virus, course when I'm saying means that it has all the antigens of the virus and will just kill the virus. Even when they tried to give it as a vaccine, it didn't work. Apparently this virus, cellular immunity is much more important compared to the humoral immunity. Yes?
Mr. Kritas, thank you for your presentation. You said that there was about 24 serotypes of this disease.
Yes.
So I would like to ask you, there are about 160 proteins in every serotype. Do we have found antibodies about every protein? And is there a relation in the antibodies of different serotypes that may be pathogenic?
That's what they try to do now at this moment, okay? Because they didn't pay attention. But even if you have antigenic, some of these are antigenic, as Professor Fodor said, it doesn't mean that if you have an antibody that you will block the virus. Okay, just the antibody is considered as a non-neutralizing antibody. Okay, it's not neutralizing, it doesn't neutralize the virus. Apparently, it has to be something more complicated for this virus. Yes?
Thank you for the presentation. And a more simple question concerning the recycling, food recycling, because it's all over Europe and even in Greece we have many companies that are activated in food recycling, and they are trying to have from industry food that are not because the date of consumption has been expired, and they are having them to feed the farms, mainly the swines. Do you think this is a proper thing to do, or it should be forbidden, and this should be even European legislation, because this is a huge thing that's happening all over Europe now. Many companies are activated to this area.
As far as I know,
for example, biscuits. Biscuits, it's a...
biscuits is not really the number one for this virus.
But many companies, I even know many people that are involved in...
You know what I'm more afraid of? Not by these companies that are producing in Greece and they cook well, whether it's expired or not doesn't matter. I'm afraid of people. You have a lot of farms that they have foreigners in their personnel, Bulgarian, for instance, or Georgian. And imagine that someone is going to his country and have this nice delicacy which is uncooked actually, and take it in the farm, and then it eats, and then it throws the other one. That's a big problem. That's a big problem. The other problem is the backyard pigs.
But in Greece we don't have too many backyard.
No, don't bet on this. Don't bet on this, because I've been, no, because I've seen, if you see the numbers coming from the ministry, they're mentioning about 1 million pigs, but if you measuring or how many sows, I don't remember because I make an investigation, and about 85% of this is in farms. So what means this? Is it in farms more than 100 sows? So the smaller you go, the less biosecurity you have. So if you have 10 pigs, I don't expect that the man in the village will put, his boots in the disinfectant, and so if he has it outside, and you see how the multiplication of the wild boars at this moment, you never know. And these boars come, there are no borders in the Bulgaria and Greece borders for these boars. They just go and move.
No, this is not easy to control.
No. Impossible.
What can we do? Well, I believe that backyard pigs should not exist. And the same goes for the sheep and goats with 5 or 10 sheep and goats. Grandma has a backyard and all the
Professor Tassis is going to tell us, are there backyard pigs to your experience?
Yes,
there are.
There are some occasions, some special occasions where many people sell few pigs to little families of few people, and they have them until Christmas, as Professor Kritas said, or perhaps Easter for like 6 months or so, and then they kill them and eat them. So
they slaughter the tree.
Yes.
And here in my eyes, and I saw it in front of my eyes, that someone, a villager, went there and asked in a farm, can I buy 2 pigs and to grow them themselves? So imagine that such a pig will come in contact with a wild boar which is infected.
Can I ask something?
Yes.
About this importation, distribution. What can we do with the committee, the Commission, the European Commission? Because Bulgaria and Greece, there are commissions in the EU. And what should be done by the authorities here to increase our measures in the borders with stuff coming in from Romania and pork products from Bulgaria? Because I think it's a little critical point there.
My impression is that because I had not very much, I'm going to have contact with some of the authorities, but my impression is that the authorities had already started to inform, because here in this point is information of the farmers and the hunters. So they had already informed about this. Now, whether they do it well or not, we don't know. But they had already started a campaign for information of the farmers. And of course they are aware of this. I don't think that will be at least a farmer, I don't know about an individual, which will go to Bulgaria and buy something and bring it here to Greece, because it's going like you have, I say Chinese roulette, we say it, okay, just one bullet, and then you don't know what are you going to do. Russian roulette, okay. Okay, so, yes. Yeah, okay.
It was really very interesting, and I think it is an absolutely hot issue. I think the key is the resistance of the virus. It is an extremely resistant virus. So the OIE made some examinations, or actually they were done in Spain for the OIE, and it was surprising that in the soil this virus can survive for 3-7 months. In the soil, which is not normal for a virus. It can, in a bacterium spore, it's okay, but for a virus, it's incredible. In the meat, it can survive 4 months. It means that if somebody is making good sausage, or ham, or bacon, or something like that, it is traditional in our country to kill the pigs in the winter and to eat the ham during Easter.
Yes.
Till Easter, it will be viable. The virus will be viable. And so it is extremely resistant. What is an important problem? You mentioned the importance of the wild boars, which is absolutely correct. The problem is that the wild boars shed the virus before the appearance of the clinical signs, 2 days before. So for 2 days, the pig is absolutely healthy, can move, no fever, can move without any problems, but it is shedding the virus, and that is a very important point when we see the spreading of the virus. Another question, what you mentioned, is the importance of the wild boars, what I believe. The problem with the wild boars that the wild boar population, as you showed it on the map, increased very much in Europe. Partially because of hobby hunting. In several places the wild boars are fed, and if an animal is fed, then it replicates like humans. And so the wild boar population is actually very high. And actually there is no real correlation. Nobody can tell you what is the correlation between the wild boar density and the African swine fever. Several years ago in Spain, they made experiences that I think half a wild boar per square kilometer was the borderline, that above this half a pig, the infection could maintain itself. But in Estonia, I think last year, there was an area where the wild boar population was 0.1. Wild boar per square kilometer. So it is not clear, and we don't know what is the reason. You mentioned the importance of the backyard pigs, and it's absolutely true. We have some experience with the Ukraine, and what happens if the backyard pig is ill? It is not eating. That's what the owner notices. What does he do? He kills the pig. What is the fate of the meat? The freezer. And it will be stored in the freezer. And in the freezer, the virus can survive several years. And when it is taken, then the story begins. So the freezer can influence the epidemiology of the disease. Sure. Disease absolutely can influence it. You mentioned the importance of the meat product and the migrants and people in this story. Several people from the Ukraine, in the Ukraine near the Hungarian border, there is quite an important Hungarian minority. They are about 200,000 people. And they come to Hungary to work, for seasonal work, mainly for agricultural work, because they want to have money. The Ukraine is very poor. And they want to make money. And on one hand, they want to earn money, but on the other hand, they want to save money. And for this reason, they take meat, bacon, ham with them, so which can be left. So they take the food with themselves.
Does this remind you something here during the people coming from Bulgaria and the north part is the same thing? So for olive trees or working in farms, so they fill their trunk of their car in order to reduce and with food and come here.
They don't buy anything. Yeah, that's a problem. And about half a year ago, the chief veterinary officer ordered that all the food has to be taken away from this worker at the border station. But it is a social question, a huge social.
There is legislation about this.
That's a legislation. That's a legislation. It's for
any food.
Absolutely.
From one country to the other.
Absolutely.
It's very, very strict legislation.
Absolutely.
They will take you.
But can you? Absolutely, I agree with you.
So.
I agree with you. I agree with you, but my.
I don't know if it is implemented well.
But I absolutely agree with this regulation. But on the other hand, can you imagine this social question?
Of course.
So it is a terrible social question to take the food from somebody who is anyway very poor, and that's a great problem. And regarding the vaccine, I am very pessimistic. Normally a best vaccine when an animal can survive an infection. If an animal survives an infection, it will be immunized on a natural way, and that's a very effective way. But in this case, The survival doesn't mean an immunity in this case, and that's the problem. For this reason, a kind of vaccine development is not promising.
Thank you, Professor Lazo. Someone else has to do any question? Yes?
Bright side of this infection probably is the control of the population and the wild boars.
How can you control them? I mean, you have them now in Fermi. How can you do this? You can kill them, but how can you? You see, the most
infections will kill the wild boars.
No, not necessarily. Not necessarily. They're going to. I don't think that the infection will manage to kill all these boars. Some of them will survive, and that's the big problem, because they will survive and will continue excreting. But as you heard, the boars are transmitting the virus before showing symptoms, before getting dead. So in that case, if they have contacts and they go in villages, in these rubbish things that I show you, together with other animals, what are they going to do? Yes.
Reducing the wild boar population is very difficult. On one hand, if you try to influence the nature, it is very difficult generally. But in this case, the problem is if you start to shoot these wild boars, they escape. They are very clever animals. And in that case, you can help to spread the infection. So actually, there was an infection focus near in Zlin. It is in the Czech Republic, not far from Brno. And they decided not to kill the wild boars, just the opposite. They fed the wild boars in the infected area. It was limited, so it was not fenced, but limited by army or by somebody else. And then left a few, sometimes, I don't know, a few weeks as I remember, as long as the virus can kill a part of the pigs, about the wild boars. And then they started to shoot. But at the beginning only individual shooting, and then at the end there was a circle shooting, so when it was an organized hunting, killing all the pigs.
And some people as well, because
sometimes some people.
The most risky hunting is this one. If I'm not a hunter, but I know several people that are killed, several cases every year because of boar hunting. Any other question? Yes?
I'd like to ask something to Professor Budapest.
Okay.
As an external observer, do you think that our country, Greece, should have taken already some extra measures regarding the surveillance of the disease? Or we have to do that as soon as possible?
I think well, the problem is, I don't know exactly the situation in Greece, I have to tell you. But if I see that Greece has ports, which is a risk. You have a terrestrial border with Bulgaria and with Turkey. And I think in this aspect you have to think Turkey as well. However, they do not eat pork, but they have wild boars. So you have terrestrial borders and that can be crossed. And we discussed the human movement from the neighbor countries. So I think you cannot be prepared, in my view. So as I know from our experience, when the first cases appeared in Poland, it was 3 years, 4 years ago.
Yes.
I have problems with the time. So about 3-4 years ago, that time we set up the surveillance zone around the border. Then the border stations were strengthened and the border control was strengthened. The import control was introduced, but in spite of that, the disease appeared in wild boars. most probably with human sandwich.
Yes.
So you can do a lot of things, but you have to accept that in spite of the perfect preparation, you can get the disease.
Also, let's not forget the insect thing, because we know about this Ornithodorus, but is it only this? I mean, a virus can be adapted, and who knows whether there are mosquitoes or some stomoxys, some flies that can transfer the virus. Even for some short time that the virus lives in, it can go and bite. Yes. For
these occasions?
For the insects?
Yes.
I don't think so. I don't think that they did any man. Well, there are some researches about. Wait. I don't know if I show you. Yes, I show you this. So you see this specific Ornithodorus lives in this one. But for stomoxys, yes, there is experimental infection, and it harbored the virus for sufficient time. Yes.
The problem with the vector, that in a non-endemic area we don't know what kind of insects are susceptible. So for a long time, just the blue tongue. For a long time, we thought that only the mosquitoes in Africa can transmit it. But when it appeared in the Netherlands and the Belgium, it became evident that other mosquitoes were able. But nobody knew, because previously there were no blue tongue virus in Belgium. And we don't know that when the virus appears, perhaps it will find a vector. Nobody knows.
Yes.
Probably that was the case also with the disease emerging in Georgia because of a possible vector that occurred there and not occurring elsewhere in the world. Yep. I don't have a question at that one.
The most likely, however, scenario is this with the ship that I told you, crossing from Madagascar through Suez Canal and went there in Georgia, and this was associated, I think, with this thing. Now, locally, how it spread, we don't know. Yeah. But as we saw before, clinically, you are not sure what is happening. A pig is febrile; it has high fever, or it gets red in the ears or so. Is it this? I mean, you have 10 different things that can cause this problem. And you lose time. That's important. Time is money. Any other question? Okay, then. In this case, I would like to thank you all for coming here. I would like to thank Professor Fodor for being here and help us in all these issues and giving these courses, and have a nice academic year.